There's a furious manhunt underway, according to the New York Times, after the head of one of the nation's largest health insurers was gunned down on Wednesday morning. This was a very, very interesting and scary story in a lot of ways. The CEO of UnitedHealthcare, his name is Brian Thompson, was killed, likely murdered, early this morning, about 6:45 a.m. He was leaving the New York Hilton Midtown, and as he's walking out, he gets shot by a guy. Now, this is not a random killing. This is not a you know, a case of like collateral damage or, an unintended target. The shooter was across the street and he let people pass. The shooter let people go by who he didn't want to shoot. He stood outside the hotel. And when Mr. Thompson showed up, he opened fire. And then while he's shooting him, his gun jams. He clears the gun and then shoots him again. And Mr. Thompson, of course, dies. He dies on the sidewalk, although he got shot in the back, got shot in the leg. Then he runs. This is about 50. If you know New York, this is about 54th and 6th, which is literally across the street from where I used to work when I worked at the Grill. I wouldn't have been there at 6:45 a.m., but it's still scary. And then the shooter gets on a city bike, one of those electric bikes, and is out. This was crazy. Dude set up, to be clear, to about 10 minutes before. It's a white man. The shooter's a white man. He had a dark hooded coat on. He had a dark mask on, covering his mouth and his nose. Just give you all the context. It's very scary stuff. The reason for the killing is not clear. But when you look at the timing, the setup, the type of weapon used, I believe there was a silencer, according to some reports. It's pretty messy. Now, I gotta be honest with you. This was one of the more shocking deaths in terms of the response. When I looked on Twitter, people had jokes. When I talked to people on the street or overheard people talking on the street, they didn't seem that upset. And when I talked about it in at least two places I was, I didn't know the people well, but I talked to them about it. Like, hey, did you hear this crazy story? People weren't that sympathetic to Brian Thompson's death. Now, I see it differently. I never celebrate death. It doesn't feel right in my spirit. And I don't necessarily think that Brian Thompson personally or individually did anything harmful to people. Now, the company does, and he's CEO of that company. But I'm saying, by most accounts, he was a decent person. And so I don't feel any kind of joy or relief that he was murdered. Somebody loved him. He's 50 years old. He had family. He had people. I don't find any joy or grace. I don't think it's funny. I don't think it's funny to talk about people who were killed in that way. But there is something instructive about the tenor of the response. The fact that people are, in fact, celebrating or laughing or joking or indifferent tells you just how strongly people oppose the structure of our healthcare system. People feel exploited. People feel hurt. People feel robbed. People feel disrespected. People, feel as if this system isn't serving them. I mean, a woman told me today that her job switched to United last year, and what was a $50 copay became an $800 out-of-pocket cost for a necessary procedure. Again, not blaming him or even United at that level. I'm saying we should use this as an opportunity to do some personal reflection. If a healthcare CEO is killed, assassinated, murdered, my question is going to be why. It's not random. It's like some John Q or some episode of Grey's Anatomy where, like a disgruntled patient or a frustrated customer decides to strike back when something, something crisis level happens, something harmful happens. It could be one of those. I don't know. Could just be a crazy person. I don't know. What I do know is the response from the public is suggestive of something. There's something we should take from this other than just, oh, Americans have a sick sense of humor. That ain't it. It's something deeper. And whatever that deeper thing is, that's the thing we need to uncover. I want to know what happened here. I want to get to the bottom of this story. And I know the police are looking for the killer. And the fact that they were able to get away says, this could be a real pro level job. This could be some major stuff here. I don't know. I don't want to speculate. But the police say that the man was, quote, proficient with firearms. That's what the chief of detectives said. If anybody can catch this person, it would be the New York police. If you're talking about city police department, they're pretty effective. We also know that there are leads. People saw him inside of a Starbucks a few hours before, et cetera, et cetera. This is also just scary at the personal level. This man was 50 and all that, but if somebody wants to touch you, they can. And I think that's the scary part for me. It's like, there's a lot of people out here who aren't well, or it's a lot of people out here who are just prone to violence. We got to figure something out in this society, yo. This is crazy. The fact that he did this in broad daylight, knowing that there are cameras everywhere, is very telling. I agree with you, Jazz LP. I don't know what that means, though. It's telling of something. I don't know if it's telling about our society, if it's telling about how much people hate the healthcare industry. I don't know if it's telling the nature of this assassination attempt, or this successful assassination attempt. I don't know. I just know this is craziness.